now it's time for Dimitris to show us how to work on the knee rehab. So Dimitris is new into our academy, but he's very talented because he's a physiotherapist. He has a MSc in molecular physiology of therapeutic exercises. And is really specialized in the corrective exercises. He's from Greece, so welcome, Dimitris.
Thank you so much. It's my pleasure to be here and be part of the Winback Academy and to be in a position for can share my mentality, my philosophy, and my experience with Winback. So today, I'm going to show knee rehab exercises about post-surgery on injuries like ACL tear, meniscus tear, and other ligaments who are inside or outside of the knee, and with conservative treatment. Also, I'm going to show you exercises about knee tendinitis, knee arthritis, and how to do stretching with Winback technology. So let's go to the next slide. For me, it's very important that we can use Winback technology than the first days after the surgery. For example, after surgery, we start with exercises which we want to improve the range of motion. We want to reduce the edema, and also it's very important to start activating the muscles. For me, it's very good to use low TECAR frequency because that helps a lot to use more hour the Winback technology. And that helps a lot because the combination of Winback and the movement give great results. I suggest during phase 1 to use a low intensity because this will help to avoid to increase the heat. Because if you increase the heat, always know that this will have more edema in the area. And this is why, first of all, in the first 2-3 days after surgery, if you can go also in the hospital work, because some doctors allow to do that, then we can use only red with very low intensity with athermy effect. And the next 2-3 days, as the days passes, you can use tense, low tense there, and after that you can put also EMS because the combination of red TECAR, EMS and tense helps also to do drainage in the area. Also, I suggest in the first days put closer, if you have the back 3, the pads. In the back 4, if you want, you can put a pad close to the knee, another pad in the muscle, more up. This is going to help also to have an effect to the muscle. Next days, when you start doing more exercises, you have 2 choices. One choice is, if you want to reduce edema, you can put close the fixed pad and the return plate. When you have there tense, EMS and red, this helps to drainage more. And also, you can put in another way in the middle of the muscle, the fixed pad and the return plate close to the knee. If you have in the middle of the muscle the fixed pad, this helps to activate at the same time the motor unit. Also helps you a lot to reduce the edema, and at the same time you can have reduce the pain which have the client. Also, we have some clients which is very important because they didn't have muscles before the surgery, that we want to increase the tension and to reduce the atrophy. Then, because we don't want to increase the heat in the joint, we can put in the muscles the pads, so that helps a lot to activate the muscle without affect the injured area. So The same is almost when we do conservative treatment. We have an athlete or a human who doesn't need to do a surgery. We follow almost the same way on the rehab plan. But now, if you want, because we can go a little bit faster, we can put more, if you want, frequencies, higher intensity in the frequencies. Also, when we put in the middle of in the motor unit, the fixed pad, and the dead plate is over the knee, then you can increase the intensity on EMS, because as I said before, you will not increase the affected area. When you do exercises about range of motion, then red with high EMS, radial, and tense, low frequency, 2 to 5, that helps you a lot to improve muscle function. At the same time, you can reduce the atrophy of the muscle, and you can increase also the joint stability because of the activation of the muscle. Here are two clients. On the left, we have a man who works just in the office. He's injured on the ski. Here we are doing a range of motion exercise. Now I work with red and the lower frequency tense. The target is to reduce the pain, and this helps more to have better range of motion and earn some degrees on his movement with the combination of that. On the right is a professional player of handball. We are in the 3rd month of his rehabilitation plan. Here I have EMS activation. He didn't have very good activation on his muscle. He came to me after 2 months of his surgery with a big atrophy on his quadriceps. But he did also exercises, so he gave me the opportunity to start working with him with more exercises. He had a good range of motion, so I started with Winback TECAR and EMS. He didn't have pain too.
So I just want to add that you have to notice that Dimitris put 2 electrodes, so 2 RET electrodes just on the quad, and then the 3rd electrode is on the calf. So that's really specific of the back fold, because you can use 3 different electrodes, 1 return plate, 2 RET, but those are 3 fixed pads. And then with the high EMS, you can stimulate the quad, plus the RET, we will stimulate all around the joint. So that's really the specificity of the back fold. Okay, sorry.
Perfect. Here, this man, he cut his quadricep tendon. He came to me 4 months after surgery. He didn't have a good range of motion, and he didn't have also a good activation of his quadriceps. In 5 therapies, we managed better his strength, but at the same time, we increased a lot his range of motion. We did exercises also to improve the elasticity of the muscle, and at the same time, after 2 therapies, we started doing exercises on the machine of leg extensions to activate more his quadriceps. By the day, we used TECAR with leg extensions that helped him a lot, also to increase his range of motion.
And it is really important to notice the position of the return plates on the RET, which are on the same side. So you see, this is for the quadriceps tendon. So that's why it's better to put the RET on the return plate on the same side to stimulate specifically the tendon, the quadriceps tendon. On the other side, if you put the return plate on the calf, in that case, your current will flow through the joint. So that's not what we want right here, because the idea is just to stimulate the tendon.
Perfect. Now, on knee tendinitis, usually here I start with isometric exercises, even when the client has pain. The combination of Red TECAR with high tense helped me a lot from the first therapies to reduce the pain of the client and also increase the ability which he has to do better motion on the joint. Always before I start exercises, I take a client, we do some warm-up on his muscle. Maybe we can do a combination with a massage with bracelet, and after that we're going outside and starting working exercises. First we start with isometric, after we eccentric, and after we finish with concentric exercises. For me, it's very important to have all the intensity of the energy to put closer the pads. This helps a lot to don't increase so much the energy, and helps you more during the combination of exercise and TECAR to have all the effects of physiology and the Winback technology, and the physiology which we have by our body, and the advantages which give the motion in a body. For me, it's better to put a high MS in the phase 2. And I want also to tell you because that the high tense, if you put an intensity 25 Hertz, maybe it is not a good guide, because the client, when you feel pain, this is a good guide to tell you to reduce maybe the stress which you put on the exercises. Sometimes there are some clients who had a great therapy, and because I had 25 Hertz, the client didn't feel the pain, but the next day he came with pain. And maybe that means that you have a bit more pressure. So when you increase, for me, the intensity at 25 Hertz, be sure that the exercise or the stress which you give on the joint is not too much, and the pressure causes him more pain the next day. EMS, I use it all more at phase 2, tendinitis. On the next slide, this athlete, he has biceps femoris tendinitis. The pain was close to the knee and a little bit outside. This athlete should play on Sunday. He came to me on Tuesday. I advised him to stop the training for 2 days. He has too much tension on hamstring biceps. In general, his legs too much tired. And I had to find a way to keep his ability to run better on the mats with the biceps, with the bicep, sorry. So we worked bicep for about 20 minutes in the second day of therapy, and after that he felt much better. After the bicep, we started working exercises about his problem, but I saw great results with the bicycle. And also here I work with 2 shirts, 10s, and around 20% low frequency Red TECAR. Let's go next slide. Now we have here many cases who old people, the doctor said that you have to do surgery now, and we delay at least 1, 2, 3 years the surgery. Now, if the client will not do surgery, knee replacement. You can work very well with a similar way with the conservative treatment like ACL or meniscus. But when we have knee arthritis, we have to bring now more blood and to improve the circulation of the joint. And also now helps to do a rep combination with high tense and high EMS. Like I said before, it's very important the intensity to be low. Usually, I work around 30, 40, 45 minutes with TECAR, and I'm doing all the program of the client combined with the Winback technology, other Winback 3 or the other Winback 4. It depends which I have available then. Usually now, because Back 4 has much better results, because you have more opportunities to work, helps around 20 to 30% more. And like I said before, for me, early phases, put the pads close to the knee, and secondly, put the pad in the middle, close to the motor unit, so you can have better activation, can reduce atrophy, and the combination of reducing atrophy and bring more blood in the affected area, this helps to reduce the pain and the stability which feel the human. On stretching, usually when I do stretch, I had like a tendinitis. An example, I put 25 hertz on tens, and we earned around 20 degrees on his range of motion. The client left from my center, and he was flying. Oh, I'm perfect. But the next day, he came with pain on his low back because of too much stressing. Maybe we stressed a lot his body, and we caused some pain. By that day, I'm always using low frequency on tens, and I want from the client to give me a guide about the feeling which he have. From then, we earn very good range of motion. This helps a lot the client on his injury, or if he has tightness, and we always take what we want from the therapy. Now, on the quad stretch, for me, put the red electrode close to the insertion of the muscle, and put it exactly down from the knee, the top of the calf, back. This helps to take more range of motion. In the hamstring, you can put it up close to the insertion, and the fixed pad in the front part of the tibia. Also, it helped me a lot when I started use high EMS when I did PNF. In PNF, I said to the client, okay, give an activation to the muscle. Now I activate the EMS, I keep it there for 5-6 seconds, and after that, I deactivate the high EMS and I take more range of motion. I again activate it, I put a little bit higher intensity, and after that, I do the same. This helps a lot.
Oh, sorry.
This is a classic.
So you put the return plate on the solar plant here.
Yes.
And where is your return plate?
This client has tightness also in the calf, and I would like to work all the leg back. This is why I put it on the down.
On the back?
Yeah, the return plate is on his low back.
Okay.
Both of them are professional handball athletes. On the left, we have hamstrings muscle strain. On the right is in the quadriceps. Here, I work with red. I do high tense, 2 hertz, and also we are in the middle of his rehabilitation plan. And I did the movement to feel better stretch. After that, we are going out and we worked exercises to increase the strength on the muscle. And on the right, here with the back 3, I have only the red. I put only the red pad and the red frequency on the TECAR.